How's it going, everybody? Wes Davies here. I've got a really special one for you tonight. Just got to film this very, very quickly because we're about to head to an izakaya for dinner. And the reason we're celebrating here in Kaohsiung tonight is because I have one of my best friends in the entire world. This is my friend Raj. He's my friend from Canada. How long have we known each other, man?
Oh, buddy, we've known each other since grade 9. We were 13 or 14 years old when we met.
Yeah, grade 9 was the year 2000, I believe.
Yeah, we had every class together in high school.
Yeah, so
Exact same
almost
schedule.
25 years, man.
Oh, it hurts when you say that.
It does hurt when I say that. I basically haven't seen you for a number of years now.
Yeah, last time I was here was 2019 when I came to pick up my wife to come back to Canada.
Your Taiwanese wife.
My Taiwanese wife, yes. And I haven't been able to be back since because of a certain virus that affected the entire planet.
I wanted to ask you, you know a lot about that virus because what is your profession?
I am a pharmacist. I work currently in a hospital in the Niagara region of Canada. I've been a pharmacist for the last 7-8 years now.
Number one, it's great to see you, man, here in Taiwan.
Yeah, as always, it's too short. So unfortunately, I can't stay any longer. I'm going back next week, but it was good to be able to come down and see you and relive some of our great times that we have and some of our good memories and come back to Taiwan. I absolutely love it here. It's one of my favorite places in the world to be.
And because your wife is Taiwanese, one of the reasons why she wanted to come back to Taiwan was because of the Taiwanese healthcare system, right?
That's correct. In Canada, we do have a very good healthcare system. It is a publicly funded healthcare system, so it's basically completely free. However, there are certain limitations with that, and she has maintained...
It's free, but it's not necessarily as efficient as some other healthcare systems around the world, right?
Yeah, because with that freedom of healthcare comes certain difficulties and challenges that have to be overcome. She has also maintained her Taiwanese health insurance, and so...
Oh, has she really?
Yes. So she's been able to do that.
Even if a Taiwanese moves overseas, she's able to maintain her Taiwanese healthcare.
That's correct. You still have to obviously continue to pay into your health insurance, but that way, when she comes home, she's still able to utilize that with her Taiwanese ID card. There were certain things that, because English is not her first language, it was easier for her to explain to a doctor who speaks Mandarin than maybe to our family doctor at home in Canada.
So why did she choose to maintain her Taiwanese healthcare, even though, as you said, in Canada, we do have free healthcare?
One of the reasons was just as a fail-safe in order to be able to manage any health issues, especially if we were traveling. It would be a lot easier for her to come home and deal with any health issues as opposed to having to go all the way back to Canada, because we like to travel to Southeast Asia, and obviously that's quite a long distance. If there's something rather emergent, it would be easier to come back to Taiwan. Yeah, the benefit that you would get from maintaining that access to healthcare far outweighs the cost that you would have to incur in paying into that.
Whereas I find anyway in Taiwan, I've got my Taiwanese health card. If I need to see a doctor, I can just decide that day. I'll just look on Google Maps, I'll find a doctor. I do have one that I like to go to. And I can just show up and I probably wait 20, 30 minutes and I'm just seeing a doctor. He waves me right into the room and he listens to me and he gives me a prescription. I always thought, oh, it's so easy. In Taiwan, we just go to a doctor's office and then there's a pharmacist right in the doctor's office. They just sit there giving the patients whatever the doctor just ordered. In Canada, it's a little bit more of a stringent process, right?
Absolutely,
The doctor writes the prescription and then they take it to you. And then you have to go through the patient's medical history report, their file, and make sure that everything lines up and there's no contraindicating medications? Is that
contraindicating medications or any contraindicating medical conditions as to why it may not be appropriate for that patient. And in a way, it's good because if there is something that the doctor may not be aware of in your visit, other medications that you're taking or other medical conditions that you may have forgotten about, to tell the doctor, we might know that. And so it's an extra fail-safe to ensure the safety and appropriateness of the medication.
So knowing all of what we've talked about and your experiences both in the Canadian healthcare system and now the Taiwanese healthcare system, what are your general thoughts overall?
I think that there's something that both systems can learn from one another. I would say that The idea that a physician in the hospital has a designated space that the patients come to, I quite like that idea. I think that seems to be a little bit more efficient in terms of treating the patient. It may be challenging for some patients to know which physician they need to see.
In Taiwan.
Yeah,
because in Taiwan is very specialized. So you'll go to one clinic, their ears, nose, and throat. Another clinic, their blood or urology.
Exactly. Another clinic will be skin doctors. And we do have that same differentiation of specialties within Canada. However, you would be seen by a general practitioner or your family doctor generally first. Or a walk-in clinic doctor, and they would triage as to which specialist you might need to see afterwards.
They might send you away to some other
Exactly, and then you might need to wait for that appointment before you can actually see the specialist. And that aspect can be a little bit more frustrating and challenging.
And I find in Taiwan, they don't really, as far as I can tell, they don't really have a family doctor as much.
No, they don't.
You just go to a doctor clinic.
Exactly. Whereas in Canada, you tend to have a family doctor who has known you for the majority of your life. They have a good record of your history.
Yeah, my family doctor in Owen Sound, I've been seeing him since I was 5 years old. So
exactly, yeah.
Like more than 30 years.
So they have the records of everything that you've gone through medically throughout your lifetime. Yeah. So that's a benefit in the Canadian system where they might catch things that again, you might not remember to bring up to your physician that you're seeing in the moment.
So in terms of your wife keeping her Taiwanese medical card, do you think she will continue to do that? Or do you think she will eventually phase that out and just rely on the Canadian system?
I think she will absolutely keep both in place. We pay for our Canadian healthcare through our taxes. So you don't really have a choice in that. That's just going to be
part of it.
It's just part of life. However, the convenience aspect of keeping it, as well as the safety for when we travel and the safety for when she's going to come home and visit her family, far outweighs any difficulties that we may have in affording that. I would say that both systems have their benefits, both systems have their drawbacks. As the healthcare systems evolve in both countries, I think it would be good for them to look at one another and really see where they can actually improve.
So it seems like each one has pros and cons,
absolutely, yeah. And that's true for every healthcare system around the world. I think that in Taiwan, pharmacists could probably be a little bit more involved in terms of helping with treatments for people.
From what I know, I actually worked in the pharmacy industry a little bit as well. I do feel that the pharmacists in Canada, they are a lot more involved in the treatment and the medication of their patients. Whereas in Taiwan, I don't see that as much from the pharmacists. It's more of a doctor-central system.
And obviously, pharmacists in Taiwan are still playing an important role in determining the accuracy and appropriateness of what's being given out. I just feel that they could probably develop a little bit more in terms of helping in certain minor ailments or certain minor conditions or treatment plans to aid the physicians and help improve the healthcare for all, really.
That's actually true because I find in Canada, the pharmacist is almost a little bit like a doctor. If you have something minor, you just go to the pharmacy and you talk to the pharmacist and they will give you medication, advice, treatment advice. Whereas in Taiwan, I think we just run to the doctor right away.
Yeah, in Ontario, where I'm from, we've just released a certain level of minor ailments that can be treated by pharmacists specifically. It's very good in triaging issues that may not necessarily require a doctor's intervention.
And lightening their workload.
Absolutely, and they're very overworked in Canada. There's obviously never enough doctors to go around for everybody. It's something that we're able to either identify issues that don't require a doctor's intervention or identify issues that absolutely would require a doctor's intervention and refer the patient to someone who is a little bit more specialized in diagnosing an issue that they may be experiencing.
Anyway, man, it's as one of your best friends, growing up, it's been so amazing seeing you. In grade 9 French class, we sat next to each other, like, trying to speak French. And now he's a pharmacist in a hospital in Canada, like a very serious and important job with a lot of responsibilities.
Oh, thanks, man.
I'm really proud of you, man.
Thanks, buddy.
So overall, how would you rate the Taiwanese healthcare system?
I think the Taiwanese healthcare system is an excellent system. They seem to be very efficient in helping to have patients actually get access to a physician.
They're a lot better at like come and go, like
definitely.
come through.
There are certain areas where I feel that they could be a little bit more efficient, especially in the medication aspect. And if they had a little bit more pharmacist involvement, or if they had pharmacists who had a little bit more jurisdiction in what they could actually do and how they could practice and help to care for their patients, that may also lighten some of the workload on the hospitals and on the physicians.
All right, man. Well, thanks for this chat. I think that was really interesting. I didn't know some of the stuff that you were talking about today. And thanks, Raj, for being in my video. I know it was a bit rushed.
No worries.
I kind of surprised him with this one. He's just here in Kaohsiung for a couple of days, so thanks for taking the time.
Everybody keep safe and keep healthy and just try and do what you can.
All right, buddy. Love you.
Love you too, buddy.
Please like and subscribe, everyone. Thanks. We'll see you later. Bye.